Hi, I'm John Preston, a rewind trauma therapist, treating people with PTSD and phobias. Today I'm going to talk about the rewind therapy technique, what it involves and how it works. Rewind therapy is different from other imaginal exposure therapies because very few details are disclosed to the therapist. Hence the treatment is known as closure without disclosure. The benefits of non-disclosure include minimising the risk of the client being re-traumatised. There is no fear of disclosing sensitive information, in the case of servicemen, for example, about deployment. For survivors of rape and sexual abuse, the benefit of not having to disclose details of the event to a stranger is self-evident. Also minimises the risk to the therapist of developing compassion fatigue, particularly for those therapists involved with heavy workloads. The rewind offers a way of permanently stopping the involuntary flashbacks by filing the traumatic event so it comes under control, but voluntary recall remains. I had a client fairly recently who had suffered with PTSD symptoms for over 45 years. He'd been reliving his trauma all that time, most days and nights. After 2 sessions of rewind therapy, the uninvited visions and sounds of the trauma, they stopped completely. A few more sessions were required to attend to a few other issues, but his life was back on track and he was able to help himself reintegrate into society and, more importantly, to start enjoying his life again. People have asked me whether they will relive the trauma during a session. Will the therapy bring everything flooding back? Because if it does, then they just couldn't cope with it. They didn't want to do it. Of course, people with PTSD relive the moment many times daily. So one more time, it has to be worth it. Plus, it's relived in a very different way. We don't remove the memory. It will always be there, but it be where it belongs and not at the forefront of your mind. When I ask clients to show me where the thoughts are before therapy begins, they always say here, right here, every time. The problem is that a small percentage of people who are traumatised by an event deal with it differently. It enters the reception area and remains there, bouncing around, never allowed to pass through into the memory area where it belongs. That's a simplified version. Rewind therapy will allow the event to pass through the reception into the correct area of the memory. I'll give you the short version of how it's done so you know what to expect. Basically, you'll be asked to watch a film in your mind. You'll imagine watching it. I usually ask you to imagine being in a cinema. In fact, if you remember the last time you went to a cinema, an image will instantly appear in your mind of that cinema. You'll see the entrance as you walk through. You'll remember the ticket booth and the pick and mix, perhaps the doors of the screening area and all the rows of seats. You might even remember the colour of the seats, blue, burgundy maybe. You'll be guided through the cinema and taken to your seat. All this is quite relaxing. Then you imagine yourself floating out of your body to the back of the cinema, watching yourself watching the movie. This is so you don't get emotionally involved with what's going on in the movie. You'll be dissociated with it. Have you ever been on a roller coaster? If you close your eyes now, you can imagine the excitement of it and the adrenaline of it. Imagine that. Now imagine if somebody had filmed you on the roller coaster and we watch it back on a film. Would it be as exciting as actually being on the roller coaster? Of course not. It's not the same. You're not associated with it in the same way. You're disassociated. It's a different emotion that's released. It might be the same emotion but not as intense. So by floating out of your body becomes less emotional about the film you're about to watch. I'll then ask you to imagine a time shortly before the traumatic event occurred. one where everything was okay. You get that picture in your head for a few seconds, then you play the movie of the traumatic event at roughly twice the speeds going forwards, including the sights, the sounds and the smells of whatever the trauma was. Then at the end of the traumatic part, you quickly rewind the movie 10 times the speed, even more than that, 20 times the speed. You can put a silly music to it playing backwards. Then as soon as it's fully rewound, you bring that image up on the screen, the one that you started with, the one where everything was okay before the traumatic event happened. When you finish, you simply open your eyes so I know that you've finished. Now that's the short version, but it's basically what happens. We might do it a couple more times, we might change it slightly, but basically that's it. By doing this, we change the emotions that were attached to that old event. It's done whilst you're calm and relaxed, and the whole feeling of the old event is changed. This allows it to move from the reception area to the memory area where it belongs. Now, if you think about the trauma, it's a voluntary recall with a different emotion attached to it, and so we feel more in control of it. Does it work for everybody? Well, it does have high success rate. Around 98% of people no longer register on the PTSD scale after the rewind sessions. For me, I'm at 100% rate, and I know many other therapists who quote the same statistics. So please don't suffer in silence. If you can find the courage to come forward, please do. We can meet face to face if you're in the same area as me, or Zoom sessions are just as effective. In fact, a recent study carried out by Cardiff University has found that rewind trauma therapy has proven to be successful using online platform, which is an excellent result for PTSD sufferers. Also, as I'm accredited with the International Association for Rewind Trauma Therapy, we are all committed to treating veterans for free. Thank you for watching.